This video is talking about the aging of the nose and aging rhinoplasty, or when should you do a rhinoplasty in someone younger. It was stimulated by a consultation I had this morning with a woman who is in her mid-40s that really was thinking about doing rhinoplasty, but she felt as if maybe only people very young do rhinoplasty, and that's simply not the case. And one of the things that I try to divide in when we think about aging of the nose is sort of, did you never like your nose? Did you not really like your nose over the last 10 years? Or did you never like your nose and now you don't like the nose even more? So the aging of the nose, that's the first psychology of it. And I'll sort of explain to you why that question is important in a moment. But the second part of it is to sort of understand how nasal aging occurs. And I'm going to divide it to like less than 60 years old and over 60 years old, so you can understand. Then I'm going to put it back in the context of that question so you understand this better. So I believe most nasal aging before the age of 60 or before the age of 55 or so is actually not nasal aging. Your nose is actually not getting bigger, as they say. And actually, your nose doesn't necessarily get bigger after 60 either. We'll clarify what's happening. But in younger noses, that something is occurring where you think your nose is getting bigger and you're thinking, what's going on? It could be rhinophyma, which is a disease where the nose gets bigger, but most likely in 99.9% of the cases, it's not that. What's happening as we get older is our face is becoming smaller. So what does that mean? If you think about the facial architecture, where the facial architecture is comprised of two components: hard tissue, cartilage and bone, and soft tissue, which is fat, skin, collagen. So if we sort of divide the face into soft tissue and hard tissue, and think about that, what's happening is I do a lot of fat grafting in people, and fat grafting adds volume back. It doesn't make their faces overfilled with big cheeks or big lips, which look terrible. It's all done very tastefully, as you see on my website. But that what's happening in your 30s, 40s, and 50s oftentimes is that the face is shrinking and the nose hasn't shrunk enough. So relative size, it looks bigger. Why is that? Because the nose, for the most part, is comprised of hard architecture, cartilage and bone, and a little bit of soft tissue, but not very much. Whereas the face is mainly soft tissue architecture and a little bit of hard architecture. So the hard architecture of the face, you can lose some. If you look at some people where they've taken CT scans or x-rays over the years, especially if you have very poor dental health, you may have some evolution of your facial bone structure as we get older. That's natural. If you clench and grind a lot, you could have that. But in general, nowadays, post-Civil War, contemporary time period, we don't lose as much hard architecture because of good dental care and good hygiene as we do soft architecture. So there's a disproportionate degree of soft tissue volume loss to our face compared to our hard volume loss. So I'm not talking about someone that needs a chin implant. I'm just talking about someone that loses volume. And so that nose in relative isolation looks larger than the rest of the face, especially during those early period of time. So that's what brings me back to that question. Did you never like your nose? Did you only not like the nose over the last few years? Or have you not liked the nose ever and now you really don't like it? So let's divide those components into the understanding that I just presented here. So if you've never liked the nose and now when you look at it, it's gotten worse, then usually that has to do with the fact that you just always had a large nose, number one, and you didn't like it. But also aging has exacerbated that in the sense that now the volume has lost it, now the nose stands out more. If you said, I've never had a problem with my nose, but only in the last 10 years my nose has gotten to be much bigger in size, then usually the nose may not need a rhinoplasty per se, may still benefit from it. I've done patients where they just have a nose that looks larger, and if I just make it smaller, their face already looks more balanced. But it may not be my first go-to to have that done. And that's part of the counseling and looking at your face and giving you right counsel. Maybe a fat graft is better, because if I make the face bigger, the nose will look smaller. It'll look closer to the way you looked like in your 30s. And that's why we have to make that distinction so you understand that a little better. And so the other analogy I use is like a glass of water. If you have a glass of water on a television screen, ask you, how big is this glass of water? You say, I don't know. But if I put a shot glass next to it, the first glass of water all of a sudden looks larger, and I haven't changed the size of it. If I put a big pitcher of water next to it, this looks smaller, and I haven't changed the original glass of water size. That's the benefit of adding fat to the face, which will give you a proportional degree of better balance to the nose, but not always. Sometimes it requires fat grafting plus the rhinoplasty to get the results. Sometimes just the rhinoplasty, and again, that's a large part of that in-person consultation or phone consultation where I can look at all the dynamics there. And then the final component is, if you said, look, I've never liked my nose, but it hasn't necessarily gotten worse, then that would probably just be a rhinoplasty, right? So if someone says, I haven't really liked my nose ever and it's gotten worse, it may be a combination rhinoplasty fat graft. If someone says, I had no problem with my nose, only last 10 years has gotten worse, then it could be just adding volume to the rest of the face and not doing a rhinoplasty. And if someone says, I've never liked my nose, I don't feel it's really gotten worse, then it just may be the rhinoplasty. So these are just general concepts. They're not meant to say specifically if you fit that category that would be your case, but I think it's worth as a framework of discussion so that you have a better understanding of what's going on. Now, how about the older nose, 55, 60? Hopefully I'm not saying too old because I'm 54, but what's interesting is Asian noses don't age as much as some Caucasian noses, and I'm going to explain to you what's going on with this. So the classic example for the male nose is Leonardo da Vinci's illustrations, drawings that he's done, where you look at the older male nose and you can tell he's older, not just because he's got saggy jowls, but his nose is hanging down like this. And you think about an older nose, when you draw an older gentleman, you draw that nose, the nose is bigger, so to speak. Or for women, unfortunately, we have this drawing, or I'm sorry, not drawing, but just the concept of a witch's nose. So a witch's nose is a nose that's hooked, and it makes it look more masculine and older in appearance. That's why in rhinoplasty, oftentimes, if the nose is rejuvenated, the whole face looks younger just by doing the nose itself, or it can be a great part of a balance with fat grafting, eyelid procedures, and facelifts to create a net balance to the whole face to make it look younger. But what's happening in that older nose, and to whom is it happening? So what's happening is that between the middle to lower section of the nose, there is a scroll. What a scroll is that the middle section called the upper lateral cartilage and the lower section called the lower lateral cartilage has a component which is connected like this. As we get older, that scroll starts to unhinge and that bottom starts to fall. So the nose is not necessarily expanding in size, except for that one exception I talked about, rhinophyma, which is a condition of end-stage acne and rosacea. The nose just gets really large, sort of like Carl Malden back in the day, or W.C. Fields. And I do treat that. You can see some before and afters on my website. But what I'm talking about is the nose actually descends. So if it gets longer and descends, it looks larger. It may not actually have grown in size in terms of going outward. It may have just fallen. And that falling is what's making that nose look larger. And in a sense, it is larger because it is becoming longer. And that may require a rhinoplasty to fix it. The technique, and you can listen to my rhinoplasty videos using what's called the caudal septal extension graft, allows me a very strong rhinoplasty result that even in your 30s, I don't believe when you get to your 60s or 70s it should age. It's actually stronger than the day you were born. So that rejuvenative component is great for men and women, but in particular for women, because women have a psychosocial association of youth and fertility and femininity, that can be a very vital component toward the aging process. But also, as I told you with men, because in the Leonardo da Vinci illustrations that he's done, he showed that aging of the nose is actually very common in men in particular. Why is it necessarily more common in men than women? Men have heavier noses. They have bigger noses, so they have more ability to fall. It typically occurs more in fair-skinned men because one is they have larger noses and they oftentimes have weaker scrolls, and oftentimes they're more subject to sun damage and that weakening of the nose. So this is to sort of divide that aging of the nose into younger versus older. And also keep in mind, if the volume loss is even striking in our 60s around the eyes, and this is also sagging, you may have a double whammy, and fat grafting may be a component to get it better. And so this is just an overall idea of how noses age, and maybe it helps you understand in terms of your psychosocial reasons for wanting a rhinoplasty. Maybe rhinoplasty is the answer for you. Maybe it needs to be in conjunction with volume. Maybe it doesn't. Maybe the nose really hasn't aged. It's just that your face has fallen away from it because of soft tissue architecture collapse. And hopefully these concepts are clear for you to understand as a layperson.